some of this tension, but I've given it to you on a handout so we don't have to spend a lot of time with it here. But I'll show you how to identify these landmarks, which are also on the handout. I don't have patients do, circumferential reposturing on themselves, except if I've already identified, okay, an anterior posterior digital cue will help them if they get in a bad way before I can see them again, that sort of thing. Okay, so there are 3 different digital manipulations that we will practice. The first and most powerful, probably effective in like 80–85% of cases, is an anterior posterior laryngeal reposturing maneuver on the infrasurface of the hyoid bone, chin down. So infrasurface of the hyoid bone. So I'm going to loosen her up and make sure that she's where I want her. Sometimes I'll grab the base of the skull back here, and if they're tensing, I might have them swallow, and then I will push up and back on the hyoid bone. To find this, if you need a little refresher, because we're going to be pushing up and back on the hyoid bone on the infrasurface, okay? That's the first technique, up and back on the hyoid bone. And so if you want to find your hyoid bone, you can come up along the anterior portion of the thyroid cartilage until your fingers go back. And that's the thyrohyoid space. Glide up the anterior portion of the thyroid cartilage until your fingers go back, and that's the thyrohyoid space. You slide your fingers in here, first and third, or first and pointer. Especially men, when you're doing this, make sure you use your first and index, because guys' hands are wider and you might push on the carotid. Don't freak out. Like, unless they have had a recent stroke or they're a seizure patient, it's fine. I've done this on patients who are like a couple days post-op, and it's really okay. You just are going to feel for this thyrohyoid muscle, which is trimmed away here, right? Okay, you don't have a picture. So you'll get your bearings, and then you're going to push up and back on the hyoid bone. And in general, you kind of want, when you're doing this, you want about as much pressure as will blanch your fingernail. That's about the amount of pressure. Although people always say I push harder, but I'm kind of mean that way. So, okay, so up and back on the hyoid bone, and then I'm going to have her do a task. So I'm going to say, Maya, we're going to get your voice back today. I want you to give me the best voice you can possibly do, despite the fact I'm pushing on your throat. So I'm just going to touch your throat here. She might tense up, so I'm going to like get her used to it. It's okay.